Hello and welcome to another talk about Medicare item numbers. Today we're talking about Home Medicine Review, item 900, or HMR for short. To be precise, we will be talking about 4 most common misconceptions about Home Medicine Review. Again and again and again during my talks with GPs, I hear the same statement that Home Medicine Review is a service for people, for patients who have 5 regular medications or more. And that became embedded in almost every GP's mind that that's the eligibility criteria for Home Medicine Review. But that is not correct. That is not correct. So let us see what Medicare benefit schedule says about eligibility for Medicare for medication review. DMMRs or HMRs are targeted at patients who are likely to benefit from such a review. Patients for whom quality use of medicine may be an issue. Doesn't say anything about number of medications. What if quality of use of medicines for a particular patient is an issue, but patient takes only 3 medications or 4 medications, not 5 or more? I'm continuing. Patients who are at risk of medication misadventure because of factors such as their comorbidities. Again, not every patient with complex medical history takes 5 medications or more. I'm continuing. Age or social circumstances. The characteristic of their medicines. Maybe patient uses a couple of medicines that have complex devices. Some medicines for pulmonary conditions, medicines that require dosing, medicine that require management by a laboratory. I'm continuing. The complexity of their medication treatment regimen or a lack of knowledge and skills to use medicines to their best effect. Reading further. Examples of risk factors known to predispose people to medication-related adverse events are currently taking 5 or more regular medications, and examples of risk factors go on. So this is just an example, just someone who wrote this explanation for Medicare benefit schedule just wanted you to know some examples, but it's not what you see here. The list of examples is not eligibility criteria. Eligibility criteria for Home Medicine Review is patient is at risk of adverse medication event. That's the only eligibility criteria for Home Medicine Review, and this is very clear from reading Medicare benefits schedule. Another common misconception about Home Medicine Reviews is that Home Medicine Reviews are only for all the patients. Sorry, I've just been making notes while reading the material. Looking at the statistics, around 6% of hospital admissions in Australia are associated with adverse drug events, with almost 1/3 of admissions for the elderly associated with adverse events. It means that yes, there is a prevalence in adverse medication events among elderly, but it doesn't mean that people of other ages are not affected by adverse medication events. If we read statistics further, we see that documentation errors that occurred during transfer of care had consistently high error rates, with 52 to 88% of transfer documents containing an error. Do all the patients are the only patients who are being transferred from one provider to another? Of course not. Of course not. So everyone is at risk. People of all ages are at risk. Or medications errors in the community remain a problem, and their prevalence varies according to the stage of medication process. 10% of general practice patients in Australia report experiencing an adverse drug event. 10%. Does mean that 100% of that 10% are people over 65? No. No, of course not. So it is common misconception that home medicine review is required only for people of older age. Third common misconception about home medicine review is that it is hard to perform because of multiple steps, because a lot of paperwork involved. Well, luckily, we have technology on our side. Technology that came with such portals or such services as HMR referrals or HMRs. That technology made the process of home medicine reviews much easier. It used to be a cumbersome process with developing a referral for home medicine review. That referral had to be printed out, it had to be faxed, confirmation of the fax had to be received. With HMRX process, no such steps need to be taken. Simple referral is developed in letter writer, and a single press of a button securely transfers a referral to a accredited pharmacist. So we're saving a lot of time and paper and staff time by employing this technology. Then, of course, technology came to our help at the stage of developing the medication management plan, because the form or proforma for medication management plan that comes via HMRX is facilitates pre-printed questions, facilitates for faster processing because of pre-printed questions, or pre-printed answers rather. So there is a less writing required. So the production of home medicine review with HMRX became much easier, and doctors can spend more time with their patients rather than producing the paperwork. We will not dwell on the process of production of home medicine review using HMRX. Of course, it's a topic for a separate discussion, but definitely, the first experiences with hundreds of GPs across Australia show that, yes, we've cut the time spent on paperwork and gained time spent with the patients. Lastly, another misconception, or I wouldn't call it misconception really, it's something that is being constantly overlooked, is who can trigger the process of HMR? Who identifies the need for HMR? Previously, and of course without reading the Medicare benefits schedule, and what we have got here is an extract from Medicare benefits schedule. It's a further guidance on production of home medicine review. If we look at Medicare benefits schedule, it says the potential need for DMMR or HMR may be identified either by the medical practitioner in the process of a consultation or by a receipt of advice from the patient or a carer or another health professional, including a pharmacist. So in other words, advice from the patient listening to the concerns of the patient about medications can trigger the referral for home medicine review. That is a valid reason to start an assessment of the need for home medicine review. Just patient having a concern about their medication is a good trigger to start assessing the need for home medicine review. That was a brief overview of 4 most common misconceptions about home medicine reviews. Thank you very much for attention.